Health and wellness are very important aspects of livelihood. Both of these measures deal with quality of life, but as anthropologists, the context and content of what constitutes the quality of health and wellness needs to be considered. In this presentation, I will be looking at what changes to health and wellness populations of Aboriginal Australians have experienced since the time of colonization, why this change occurred, how this ties into sovereignty, and where the state of their health and wellness is headed. In pre-European contact Australia, Aboriginal tribes held many commonalities, yet nonetheless had numerous differences between diverse groups. Accompanying this cultural diversity was the immense and unique diversity of plant and animal life. With this bounty, it was important to have knowledge of the resources that are available to you. This knowledge was the primary way in which Indigenous Australians subsisted off their land as hunters and gatherers. Having subsisted off the resources of their land for thousands of years, Aboriginal Australians saw very little need for agriculture. Their knowledge of plants, how to collect food to feed their families, and the proper hunting and fishing techniques were enough to sustain them. Over time, they became accustomed to the lives they were living. It comes as no surprise, then, that once Great Britain colonized Australia and disrupted that comfortability and familiarity with their environment, aspects of Aboriginal health and well-being changed. Before colonization, the average diet of an Australian consisted of primary protein sources from animals and carbohydrates and fiber from plant material. According to Jeanette Brand-Miller and Suzanne Holt in their study on plant foods and the nutritional and health impact they have on Aboriginal Australians, between 20 to 40% of their diet was plant-based. Because the nutritional contents of plant matter consumed by Aboriginal Australians was in stark contrast to the high protein and fat animal foods, Brand, Miller, and Holt theorized that these plant resources were protective foods that helped to ensure the high fat and protein diet being consumed did not have adverse effects on health. This division of the diet in certain proportions was to ensure all the nutritional needs of hunter-gatherers were met. Because of the amount of effort it takes to hunt, hunting can be seen as less fruitful in comparison to the plethora of plants available to gather, even though the caloric payoff differs vastly between the two. Aboriginal Australians recognize the importance of a well-balanced diet as evidenced by the categorical divisions within food recognized by various tribes. Dr. J. A. Waddy highlights this with her description of the people of Groote Eylandt, the Anandil-Yakwa, and how they classify food. For the Anandil-Yakwa, food was divided into two categories. The first is flesh foods, or aqualia, consisting of the flesh of a sea or land animal. The second is non-flesh foods, or aninga, of which there are three subcategories, of fruits, roots, and foods from flowers. However, since colonization, the categories these people have built for themselves have had to change to align with new foods and food philosophies brought to Australia through globalization. Because of this new influx of strange foods and the odd practices that accompany it, the gastronomical landscape of Australia shifted. Suddenly, cattle were being raised all over the country and changing the environment around them. Plant resources were becoming less utilized, and the knowledge of those plant resources started to erode, thanks to cultural and physical genocide, as well as forced re-education. Today, as a consequence of that loss, Aboriginal Australians have an average life expectancy of 20 years less than the rest of Australia's population. Their rates of coronary disease and metabolic disorder occurrence is double that of the rest of Australia. Between 2002 and 2003, circulatory system diseases such as heart attacks and stroke were the leading causes of death among Indigenous men and women. How did this happen? The answer is complex and involves social, economic, and environmental issues that stretch back to the era of first contact. As stated before, the rapidly changing landscape infrastructure of Australia due to cattle grazing was a huge blow to native plant proliferation and utilization, along with other environmental factors like drought. As for the social and economic side of the issue, we find that around the world, marginalized populations often receive the short end of the stick when it comes to economic opportunity, healthcare, and access to proper foods. The same is true for Aboriginal Australians. The systematic prejudice against their group in numerous aspects of society, as well as assimilation efforts, having helped to encourage the adoption of a globalized food philosophy. Now we see Indigenous Australians frequenting the supermarket more than they forage or hunt. For instance, over 90% of foods eaten by Northern Territory residents came from overseas, according to a study done by Taylor and Westbury for the Center for Aboriginal Economic Policy Research. This is not necessarily a bad thing, as healthy food can still be concocted from food bought at markets when paired with a proper food education. However, it does raise eyebrows when the majority of food consumed is non-native and rates of metabolic disease are above average. This lack of food sovereignty in Indigenous communities around Australia is a huge problem. A lot of it has to do with the modern changes to how many humans are accessing food. This culture of consuming food that others have grown or collected is adversely affecting how some interact with local and native food resources. Thankfully, people are stepping in to change the trajectory of this issue. Many studies, such as the one done by Brandmiller and Holt, have been created to assess what nutritional needs Aboriginal Australian communities require in order to reverse some of the changes that have occurred. Other works done by scholars are looking into this issue with a focus on the barriers to access to proper nutrition. The Taylor and Westbury study proposes numerous ways to move past these barriers, such as redesigning grocery store infrastructure to reduce economic strain and encourage nutritious habits. Another strategy that has been touted is the implementation of nutrition education in schools. These practices are aimed at teaching Indigenous children and communities about proper nutrition and have been proved to be successful when accompanied by revised store infrastructure. Moving forward from these findings, it is important to note that there is no one solution to a systemic health problem such as this. In order to change what has become both an individual and community issue, more on-the-ground research and census-taking needs to continue being done, and more engagement on everyone's part is necessary. To conclude on many of the sentiments presented in this video, I would like to ask everyone to think a little more critically about their food habits. Many of us have strayed far from the dietary habits of those before us, but often do not consider the potential consequences of that diversion. For some, however, those consequences are far-reaching and all too real.